part 3 of the video series on improving diabetes management and outcomes presented by Superior Health Quality Alliance. This third video will explain patient-centered care and the role of interdisciplinary teams. The objectives for this learning session are to achieve the following: understand patient-centered care and treatment of diabetes, identify barriers and strategies to improve diabetes outcomes, and understand the importance of an interdisciplinary team. We will start with patient-centered care. Patient-centered care is a healthcare approach or model that focuses not only on the patient's symptoms and medical history, but also on emotional, social, and financial factors that affect their life, as well as their values. It is comprised of the 8 core principles listed here. I would like to review each one with consideration to an individual with type 2 diabetes. The first core principle is ensuring patients have timely access to care. This can be accomplished by offering multiple ways for them to access care, which can include telephone or telehealth visits, phone consultations, online portals, or walk-in clinics, all of which to help address any concerns or issues before they become severe. The second is building trusting relationships. When treatment is provided by healthcare professionals the patient trusts, they are more likely to follow the treatment plan and share important health information. The third is ensuring care continuity and effective transitions. Effective, smooth transitions with clear communication between different care settings, such as between various healthcare providers or hospital to home care, reduce the risk of medical errors and ensure that all aspects of an individual's diabetes care are aligned and well managed. The fourth core principle is family and caretaker involvement and support. Involving family members and caregivers to provide emotional support, assist in monitoring blood sugar levels and meal planning. It improves the patient's adherence to their management plans. The fifth is transparent communication with an emphasis on self-care. Provide clear, honest information about their diabetes, educate them on treatment options and lifestyle changes, and emphasize self-care practices like regular blood sugar monitoring, healthy eating, and physical activity. The sixth core principle is respect for patient preferences and involvement in decision-making. It is essential to tailor the diabetes management plan to meet that patient's preferences, values, and needs. Involving them in their treatment options and respecting their choice is crucial in honoring their right to make informed decisions about their diabetes care. The seventh is empathy and emotional support. Patients are more than just their disease. Offering resources such as counseling, support groups, and mental health services are all essential to ensure the patient's mental health well-being and comprehensive emotional support. The eighth and final core principle is the consideration of environmental and physical needs. Screening and identifying social drivers of health is very important to ensure that patients have the necessary support and access to the necessary resources. This includes housing, transportation, and access to nutritious food, all of which can significantly impact a patient's diabetes outcomes. These principles collectively aim to create a healthcare system that is responsive, respectful, and tailored to the unique needs of each patient, ultimately leading to better health outcomes and higher patient satisfaction. Barriers and strategies to improving diabetes outcomes. Caring for patients with diabetes can present with challenges. I would like to highlight the most common barriers. The first is the progression of diabetes and its complications, which can cause patients to become discouraged. Unfortunately, diabetes is not curable and does progress over time. This means what works today may not work next month or next year. Patients often get discouraged when their blood sugar levels rise despite following their diet and exercise plans, and this impacts their level of engagement. Social drivers of health can be a significant barrier. Food insecurity or being able to afford medications significantly impacts the outcomes in patients with diabetes. It's also important to consider complications and comorbidities. Diabetes can cause problems in many parts of the body. Patients often face multiple health issues at once, such as obesity, hypertension, and high cholesterol. These factors can contribute to complications like nerve and kidney damage, kidney and heart disease, stroke, and peripheral artery disease. Patient engagement also is a factor. Patients in denial or who are unwilling to change can be a significant barrier to manage when trying to improve their diabetes outcomes. Finally, geriatric syndromes is another key barrier and includes a number of conditions related to aging, such as dementia, depression, delirium, incontinence, and falls, to name a few. There are barriers, but there are also some effective strategies to reduce these barriers. First, we need to optimize the behavior of the provider and the care team. This means implementing standardized care processes and protocols, such as regular monitoring of A1Cs, blood pressures, and lipid levels to ensure consistent patient care management. The care team should be able to act promptly to adjust treatment plans when blood sugar levels rise. Supporting patient behavior change and improving diabetes management involves personalized education. When patients are resistant to change or become discouraged, use motivational interviewing to encourage and to engage them in their care, helping them reach a middle ground in adherence to their treatment plan. Utilize nurses to provide patient education on blood sugar monitoring, lifestyle changes, nutrition, meal planning, all of which result in big benefits to improving a patient's physical function and ability to manage their diabetes effectively. Medication reconciliation and management is crucial and often missed, especially when patients are treated by multiple providers. We need to avoid drug interactions and ensure patients are on the right medications at the right dose and taking them at the right time. Lastly, registries are important to track and manage patient care and data, ensuring timely follow-ups and interventions. Now let's discuss interdisciplinary teams. The Interdisciplinary Team, IDT, is a group of healthcare professionals from various disciplines who collaborate to provide comprehensive care for patients. Each member brings their expertise to address different aspects of a patient's health, leading to better management of the condition and improved outcomes. There are many key players in the IDT team for diabetes care: primary provider and endocrinologist, nurse, who can also be an educator or nutritionist, pharmacist, mental health professionals, specialists such as nephrologist, neurologist, podiatrist, and cardiologist. Developing respect for handoffs requires buy-in from all disciplines. Each discipline needs to incorporate changes into its practice and culture to ensure better diabetes management. Interdisciplinary Team, IDT, approach in healthcare provides numerous benefits to patient care. IDTs facilitate better communication among healthcare providers, ensuring that all team members are informed about the patient's condition and treatment plan. There is better coordination of care, resulting in smooth and effective transitions between different care settings. And interdisciplinary cooperation is associated with lower hospitalization rates and reduced complications, which adds increased patient safety. Collaborative care models like IDT have been shown to improve patient outcomes, including better management of chronic conditions like diabetes. IDTs make better use of the diverse skills and expertise of its team members, leading to more efficient and effective care. When care providers work together to ensure the right information is communicated at the right time to the right people, patients are provided safe, appropriate, and effective care. Key takeaways and resources. In summary, here are some key takeaways from today's presentation. When creating a diabetes management plan, it's crucial that the clinical team do it in partnership with the patient. Patient commitment to their treatment plan is improved considerably when it's guided by their values, beliefs, and cultural influences. Clinical team members must be ready to act promptly to adjust treatment plans when blood sugar levels rise. One of the most important members of the team to ensure good outcomes is the patient. And lastly, patient-centered care engages patients and their families in shared decision-making model, leading to improved health outcomes. Here are the resources cited in today's presentation. If you have questions about this video series or others, please contact us at info@superiorhealthqa.org. Thank you.